As an osteopath, one of the first things that you learn is how to diagnose a thoracic spine. Not only is this important for the clinic and for your exams, but this also lays the foundation for everything else in the rest of this course. So to start off with, we're going to go over some very basic landmark anatomy to make the diagnosis. And the first thing that you need to understand is where the three important landmarks are. You have the body, you have the transverse process, and you have the spinous process. So this is what it'll look like from a lateral view. And if you're looking from the top down, you're going to see something like this, where this is the body, this is the transverse process, and this is the spinous process. It's important to know where these three are because the body tells you which direction the vertebral segment is rotated. The transverse process is what you palpate to assess for rotation. And the spinous process is what you palpate to tell which vertebral segment you are at. So the next thing that you need to understand is the rule of threes. And the rule of threes are a set of guidelines that tell you where you are in the spinal column. Each spinous process comes out at a different angle depending on what level of the spine you are at. So for T1, 2, and 3, the spinous process comes out directly posterior or directly horizontal. So it's at the same level that the vertebral body is. It's at the same level as the transverse process. So if you're looking at it from the posterior side, you're going to see something like this. The spinous process is going to be on the same level as the transverse process. So as you move further down the spine to T4, 5, and 6, the spinous processes are going to come out at a little bit of an angle. They're going to go down half of a level. So if you're looking at this from the posterior side, you're going to see something like this, where the spinous process comes out half of a level below the vertebral body. So this is important because if I'm trying to palpate the transverse process of T5, I need to find the spinous process, march my fingers up half of a level, and then palpate horizontally to find the transverse processes. So the next three, T7, 8, and 9, come out one full level below. So they're going to look like this. If you're looking at it from the posterior side, you're going to see something like this, where the spinous process goes down one full segment. So if I'm palpating the spinous process of T8 and I move my thumbs horizontally, I'm going to be palpating the transverse processes of T9. If you need to palpate the transverse process of T8, you need to find the spinous process, move up one full level, and then go horizontally. On exam questions, they may say you palpate the spinous process of T8, and then to the sides of it, you palpate the transverse processes. They're telling you that this is T9. So for the last three, you take the other rule of threes and you flip it. So for T10, it follows the same rules as T7 through 9. For T11, it follows the same rules as T4 through 6. And for T12, it follows the same rules as 1 through 3. So now that you know which vertebral segment you're at, you need to be able to name a dysfunction. And there are three components that go into naming a dysfunction. You have the flexion and extension component. You have the rotation. And you also have the side bending. So for an example diagnosis, let's say that you have T6 and it is flexed, rotated right, and side bent to the right. So remember, you always name the dysfunction by what it can do. So this says that T6 can flex normally, can rotate to the right, and can side bend to the right. So for each plane of motion, you can have only certain movements. So you can have either a flexed, extended, or neutral dysfunction. Rotation, you can either have a right rotation or a left rotation. And for side bending, you can either be side bent to the right or side bent to the left. So now once that you know the motion, now you need to find out how to make the diagnosis. So the first thing that you do is assess for rotation in neutral. So how do I assess for rotation? So what you're going to do is you're going to take your thumbs and you are going to come to the posterior side and you're going to palpate the transverse process of each vertebral segment. Depending on how deep your thumbs go in will tell you what direction the spine is rotated. So if both thumbs are level, that means that that vertebral body is not rotated. If your left thumb goes in deeper, that means that you're rotated to the right. And if your right thumb goes in deeper, that means that you're rotated to the left. So drawing it out, if you have a right rotation, it's going to look something like this. And now when I'm palpating the transverse processes, my right thumb doesn't go in very far, but my left thumb goes in pretty deep. So this tells me that it's rotated to the right. The way that you name the rotation is which direction the vertebral body is looking. So the vertebral body is looking to the anterior side to the right. So this tells you it is a right rotation. So once that you have the rotation component, the next thing that you need to do is assess for rotation during flexion. And when you do this, there are two outcomes that you can have. It can either get better in flexion, meaning that when you're palpating in flexion, the rotation goes away, or both of your thumbs are now even, or the rotational component doesn't get any better or gets worse. Remember, you have to name it by what it can do. So if the segment gets better in flexion, it can go into flexion. That means that it's a flex dysfunction. Now if it doesn't get better in flexion, the next thing that you're going to need to do is assess during extension. So you're going to do the same thing. You're going to ask the patient to puff their chest out, extend to the vertebral level, and you're going to assess for rotation on the transverse process. Two things can happen here. It can either get better during extension, meaning that the rotational component during extension goes away and both of your thumbs are even, or it can get worse or not change during extension. Once again, if it gets better during extension, that means that it can do extension. So that means that you have some sort of extended dysfunction. If it doesn't get better during flexion and it doesn't get better during extension, that means that you have a neutral dysfunction. In real life, you're going to have to assess for rotation and flexion extension maybe a few times to be able to really tell if it's better during flexion or better during extension. On the exam, they're just going to tell you it gets better during flexion, it gets worse during extension, so you can figure out if it's a flexed or extended dysfunction. So now that you have two components of flexion and extension or neutral and rotation, the final thing that you need to do to make the diagnosis is assess for side bending. And the way that we're going to do that is by using Fryette's laws. Now, Fryette's laws are a set of rules that tell you which direction the vertebral segment is side bent during flexion, extension, or neutral. So type 1 says that during neutral, rotation and side bending occur in opposite directions. So one easy way to remember this is if you draw your N, you put arrows on both sides, they're going in opposite directions. So side bending and rotation occur in opposite directions. Type 2 tells you about flexion and extension. This rule says that during rotation and side bending of a flexed or extended dysfunction, they both occur in the same direction. Easy way to remember this is to put arrows on your letters. So they're all going in the same direction, meaning that if it's a flexed or extended dysfunction, rotation and side bending both occur in the same direction. Now there is a third rule. And it's about stacking. It doesn't necessarily help you with making the diagnosis, but it is important to know. What this says is that during the 3 planes of motion, flexion, extension, side bending, rotation, the range of motion that you go in one direction will limit the range of motion in the other 3. So the more that I flex forward, the less I'm going to be able to rotate and the less I'm going to be able to side bend. So stacking. Not very useful to make the dysfunctional diagnosis, but still important to know. So now that you know the side bending component using Friat's laws, the rotational component, and the flexed, extended, or neutral component, you now have your diagnosis. And the easiest way to go over this is to go through some practice questions. So let's say you're taking the exam and it says that in neutral, you palpate that the patient is rotated to the left. It gets better in flexion, meaning that your fingers become more level during flexion. It gets worse in extension, and it doesn't really tell you anything about side bending. So what's the diagnosis? So you know that it gets better in flexion, and if you go through the flow chart, you know that it must be a flex dysfunction. So let's say this is T6, flexed. They told you that it is rotated to the left, so rotated to the left. And using Friat's second law, for a flexion dysfunction, that tells you that rotation and side bending are in the same direction. So you know that it's rotated left, which means that this is also side bent to the left. So another practice question. Let's say that they tell you during neutral, you're rotated to the left. The rotational segment doesn't get better during flexion and does not get better during extension. And they also don't tell you what the side bending is doing. So what's the diagnosis? So let's say that we're at T6 again. They give you that it's rotated in neutral to the left. So if we start here, it doesn't get better during flexion or extension, so we know it's a neutral dysfunction. So you can write down neutral. Using Friat's first law, neutral dysfunction, rotation and side bending are in opposite directions. They tell you that you're rotated to the left, so you can do rotated left, side bent to the right, and that'll be your diagnosis for that. Next question. Let's say that they don't tell you anything about rotation, but they do tell you about side bending, and they say you're side bent to the right. They say that it gets better during extension and gets worse during flexion. So what's the diagnosis? So this question shows that really you can flip this flowchart backwards if you need to. If you're given side bending and not rotation, you can still run through the flow chart. You can also still use Friat's laws and work backwards. So if it's a neutral dysfunction, side bending and rotation are still opposite. So for this dysfunction, let's say it's T6, again. Side bending to the right, that gets better in extension. So it's an extended dysfunction. Since it's an extended dysfunction, we can follow Friat's second law, saying that rotation and side bending are in the same direction. And we know that it's side bent to the right. So we're rotated to the right and side bent to the right. So for the last practice question, let's say that they tell you during neutral, you're rotated to the right. They don't tell you anything about flexion, and they don't tell you anything about extension. But they tell you that side bending occurs to the left. So what do? So it doesn't get better in flexion or extension, so you know it must be a neutral dysfunction. You can double check yourself because rotation and side bending occur in different directions, which is a type 1 mechanic rule. So T6, neutral, rotated to the right, and side bent to the left. So during this lecture, we went over how to palpate the landmarks that are important for your diagnostic findings, the rule of threes that tells you where you are in the spinal column, as well as the relation of the spinous process and transverse process, how to name a thoracic diagnosis, Friat's laws of how to find side bending, whether it's a neutral, flexed, or extended dysfunction, your diagnostic flowchart, and a couple of practice questions. And that's how you diagnose the thoracic spine.